This is Sindel Thompson. I am an LPN to BSN distance learning student at Indiana State University. This is a presentation I have created on sexually transmitted infections among adolescents and young adults. It will offer information on risks and guidance on how to prevent STIs. Please pause the video and complete the pre-post test linked under this video in the description area to assess your current level of knowledge prior to proceeding with this presentation. Learning objectives. We're going to learn about who is at an increased risk of contracting STIs. We're going to discuss the prevention of STIs and detection of STIs. We'll also discuss the long-term effects of untreated or inadequately treated STIs and how you can go about being tested. Who is at an increased risk? Almost half of new sexually transmitted infection cases in the United States are found in youth and young adults aged 15 to 24 per the CDC. Females are at an increased risk of contracting sexually transmitted infections. Minorities are also at an increased risk. Any individual who is sexually active, whether they are having oral sex, anal sex, vaginal sex, it does not matter. Any type of sexual interaction can increase your risk for sexually transmitted infection if proper prevention is not used. Having multiple partners increases your risk for sexually transmitted infections. So if you only have one partner, but for some reason your partner has multiple partners, you also are at an increased risk. So even though you only have a single partner, your partner is seeing other people and having sex with them, that increases your risk of contracting sexually transmitted infection. Also, males who have sex with males are at an increased risk of contracting STIs. Substance use and abuse. This includes alcohol and drugs. Because these things lower your coherence level and your ability to make logical and appropriate decision, these substances can lower those inhibitions and cause you to make poor decisions, which puts you at an increased risk of contracting STIs. Exchanging sex for money or drugs also increases your risk. Generally, that results in multiple partners or exchanging sex with someone who does have multiple partners. Having a mental health disorder. People with mental health disorders can be at an increased risk of contracting sexually transmitted infections. And like I said earlier, people that have financial difficulty, so people in lower income socioeconomic status, those individuals are at an increased risk of contracting sexually transmitted diseases or infections, STIs. Prevention and detection of sexually transmitted infections. Prevention. Obviously, abstinence, completely refraining from sexual interaction of any kind, is going to prevent you from contracting sexually transmitted infections. For more obvious reasons, abstinence is not always the case for everyone. Not everyone is going to abstain, so you have to understand that not everyone is going to refrain from having sex. That's why sex education is very important. We need to make sure that we are educating our youth, our adolescents, our young adults, the proper ways to have intercourse or to have sexual interactions to help lower their risk of contracting sexually transmitted infections. This requires open communication. Parents and adults need to be able to have open communication with the youth. Our younger population needs to be comfortable with having communication with us, discussing these things with us. So any opportunity you find to have those conversations with them to help educate them on the proper, most appropriate ways to help prevent contracting sexually transmitted infections is an opportunity that should be seized. Condom use, always, no matter what. Oral sex, anal sex, vaginal sex, always using condoms. Condom use will definitely reduce the risk of contracting sexually transmitted infections. Regular screening, also something that is important. Even if say you have a child and your child is telling you that they're not sexually active, it's still a good idea to have them screened because sometimes they don't feel comfortable discussing those things with adults. So regular screening will help detect sexually transmitted infections early and prevent those infections from being spread to others or prevent them from causing long-term effects. Detection. So detection, we want to do regular screening annually and with every new partner. So every year for sure if you have one partner. If you have a new partner, you want to make sure you're having tests done after every new partner, just to make sure that you're not having anything introduced that you did not have prior. You should also suggest that your partner be screened. This prevents you guys from giving each other infections that the other may not have. And sometimes these STIs don't have symptoms. So regular screening is important because you may not have any symptoms of any kind, but you may actually have an infection. And when those infections go untreated, they can cause significant problems for the rest of your life. The way these tests are performed are urine tests or swabs. They can do vaginal swabs, anal swabs, penile swabs. If you have lesions, they'll swab the lesions just to test to see, make sure that there's not any sort of bacteria there, and if there is bacteria, what it is, so it can be treated appropriately. Long-term effects of untreated and or inadequately treated STIs. Pelvic inflammatory disease. This is in females, and it can cause chronic pelvic and abdominal pain. It can also cause inflammation in your reproductive organs that can lead to infertility. That's irreversible infertility. It can cause neurologic problems, headaches, paralysis, numbness, memory loss. It can also cause internal organ damage. Sexually transmitted infections can, if they go untreated, can cause internal organ damage. They can become systemic. So rather than just being in your sexual organs, they can actually travel through your bloodstream and affect other parts of your body so significantly that they can actually cause death. Can also cause blindness. How to be tested. You can call your doctor to schedule an appointment. You don't have to tell the doctor or the person over the phone what you're scheduling the appointment for. You can keep that communication between you and the medical staff once you're in a room so that it is private. You can contact your local health department. They do sexually transmitted infection screenings. You can go to teensource.org to locate clinics that will offer STI screening. You can also order an at-home kit. NERCS has a website. They do birth control. They do various things, but they do STI testing. They'll send you a kit to do the testing at home. And then there's also a community health testing facility. It's an HIV community service, so they primarily serve the HIV community, but they also offer free and low-cost sexually transmitted infection screening tests. Please complete the pre and post tests again. It's linked under this video in the description area to assess your level of knowledge upon completion of this presentation. There's also a brochure that accompanies this video. It is also linked under the pre and post test in the description area under this video.